Hi everyone, and welcome back to the Biotix Care YouTube channel. My name is Sky, and today we are going to be talking about Crohn disease. So Crohn disease, also known as Crohn's disease, is a type of inflammatory bowel disease. It can affect any part of the gastrointestinal tract from mouth to anus, though it usually affects the end of your small intestine and beginning of your large intestine. So what causes Crohn disease? So the cause of Crohn's is unknown, but many experts believe that it is an abnormal response of the body's immune system against bacteria in the intestine. So this abnormal response triggers inflammation that damages the intestinal wall and allows bacteria to move from the intestines into surrounding areas of the body, leading to more inflammation and more tissue damage. Crohn's disease usually starts in the teens or 20s, but can occur at any age. It also affects men and women equally and tends to run in the family. So what is going on inside your body when you have Crohn disease? So like I said, it is a chronic inflammation within the GI tract that may extend through the entire thickness of the intestinal wall. So this inflammation can be patchy, but it can even dive into deeper layers of tissue. So again, it can be limited to one spot, but it can also spread along the length of the bowel wall. So the immune system also plays a huge role in this condition. The immune cells accumulate in the intestines, attacking bacteria, food, healthy body tissue, harmless, and even beneficial substances. And these accumulating immune cells actually produce chemicals that cause inflammation, damage intestinal walls, and cause Crohn's symptoms. So what are the symptoms relating to Crohn disease? Some GI symptoms include persistent diarrhea, rectal bleeding, urgent needs to move bowels, abdominal cramps and pains, sensation of incomplete bowel evacuation, and constipation. So IBD can cause systemic symptoms outside the GI tract that affect your overall health and quality of your life. Some of these symptoms include redness or pain in the eyes, mouth sores, swollen joints, skin complications such as bumps or rashes, fever, loss of appetite, weight loss, fatigue, night sweats, loss of natural menstrual cycle, osteoporosis, kidney stones, and even liver complications. So how is Crohn disease treated? So treatments include drugs that suppress inflammation, immune system suppressing drugs, antibiotics for the infections that occur when dealing with Crohn disease, and even surgery to remove scar tissue within the intestines. So how is diet involved? So foods don't cause Crohn's, and there's no special diet that has been proven effective in treating it. However, certain foods may cause flare-ups for certain people. So some foods that are likely to cause symptoms are foods high in dietary fiber and fat, dairy, and carbonated drinks. However, bottom line is there is no one diet that can alleviate Crohn's disease. Yet an important step in treatment for Crohn's disease is keeping a detailed food diary to be able to avoid the foods that trigger your symptoms specifically. There are also a few eating habits to consider, and these include eating small meals or snacks every 3 to 4 hours. Also, staying hydrated by drinking small amounts of water throughout the entire day. Also, during periods where you aren't dealing with any active symptoms, it's a really good idea to include a ton of whole grains, fruits, and vegetables, while still making sure to do this slowly in small amounts. And when dealing with symptoms such as diarrhea or abdominal pains, try to stay away from foods high in fiber and raw foods. So how does Crohn's disease affect your gut health? So not only can it affect your entire GI tract, but it also affects your gut microbiome. So what does this mean? Your gut microbes have many roles, and these include influencing your immune system, breaking down food compounds that could otherwise be toxic, making vitamins and amino acids, preventing the overgrowth of harmful bacteria, and helping you to digest complex complex carbs such as starch or fibers. So we do know that people with Crohn's have different microbiomes than those without it, and their gut microbiomes tend to have less diverse community of bacteria and less of certain species that help to reduce inflammation. Now, it's not clear if these changes either cause Crohn's or whether they result from the symptoms or treatment, but this microbial imbalance in people with Crohn's could also be related to things that happen during flares, such as poor absorption of nutrients, higher levels of water or blood in the intestines, and more urgent bowel movements. So with this microbial imbalance, not only does the gut suffer, but it can't properly do its job, which includes things like immune support, digestion, brain function, sleep, etc. So how can probiotics help to prevent and manage Crohn disease symptoms? Though more research needs to be done, the scientific community is really excited about the possibilities of probiotics for IBD because they are easy to administer, relatively cheap, and could help relieve IBD symptoms. So by increasing your probiotic intake either through supplements or probiotic-rich foods, you are able to replace that good gut bacteria and hopefully reduce Crohn's symptoms. And like we spoke of earlier, antibiotics can help in the treatment of Crohn's, but though they are effective at killing off the bad bacteria, they're also just as effective at killing off the good gut bacteria. Therefore, by adding a probiotic supplement, those suffering with Crohn's will be able to reintroduce that good gut bacteria that the antibiotics have killed. So when it comes to any inflammatory bowel disease, it is super important to speak with your doctor to find the right treatment for you, since it does affect everyone differently. However, taking a daily probiotic supplement is one of the best ways to rebalance your gut microbiome, giving your gut the resources it needs to reduce Crohn's symptoms as well as benefit the rest of your body. Although there is no cure for Crohn disease, it can be managed with treatment. So we hope you enjoyed this video and learned something while you were here, and if you are looking to add a high quality probiotic to your routine, I highly recommend checking the links in our bio or going to bioticscare.com to learn more about our products and how they can help you on your gut healing journey. Don't forget to subscribe so you don't miss a video, and comment down below what you would like us to talk about next. Thank you so much for watching, and we will see you in next week's video.